Hello everyone, Dr. Fink here. Today we'll talk about blood appearing in the syringe or blood coming out of the injection site after you pull out the syringe from an intramuscular injection, such as in testosterone injection. Quick disclaimer, this is not medical advice, this is entertainment only. So for those who inject a lot intramuscularly, such as TRT patients, sometimes you might notice that there's some blood drops coming out of the injection site, or there's some blood inside of the syringe when you pull out the syringe after the injection. And you might wonder where it come from and should you worry about it. So if we look at the breakdown, we are basically injecting inside of the muscle. And by doing this, we go through the skin and through the subcutaneous tissue, which is mainly made of fat, and then into the muscle tissue. And here we have blood vessels on the way. And if we are unlucky, we can nick or hurt one of those blood vessels of these very tiny small capillaries inside of the subcutaneous tissue or inside of the muscle tissue. And once we pull out, then due to the difference in pressure, there might be some of that blood that leaked out that goes up in the syringe and accumulates here in the syringe. Or if it's very close to the skin, it can also burst out and cause this bleeding at the injection site. So having blood, small blood amounts in the syringe, or having a little bit of blood leaking out of the injection site does not 100% mean that you injected inside of the blood vessel and that the drug is inside of the bloodstream. Okay, actually, it would be very hard to aim for a blood vessel and get the tip of the needle inside of this very slick and slippery blood vessel, and pressing the plunger would also cause some wiggling, and it would be nearly impossible to hold the needle still to really inject the full amount of your syringe right into that blood vessel. Okay, so when that blood appears, it is most likely that passing through, you hurt, you nick that blood vessel, and then on the way out, the blood just comes out. Okay, it doesn't mean necessarily that you injected everything inside of the muscle. Okay, of course, it could be that if you inject at the wrong spot, that you hit a larger blood vessel, and in this scenario, this might be an option. But usually, if you keep with deltoid or gluteal injections, uh, the risk of injecting into larger blood vessels is very low, and usually it is just because you nicked a blood vessel on the way in or out of the injection site. And last question, should you aspire before the injection, yes or no? Back in days, aspiration, so you would put the needle inside of the muscle, and then before you inject, you would aspire, so pull the plunger to see if there is some blood coming out. Those techniques have been recently not be recommended by major healthcare organizations, since it doesn't make much sense, because once you pull on the plunger, the needle can change location, and even if you had a little bit of the tip inside a blood vessel, by pulling the plunger, this might change the exact location of the tip of the needle, so it is not very accurate. Okay, so it has the recent recommendations are to not aspire for intramuscular injection, since this can cause more discomfort and more scar tissue buildup as compared if you just inject normally, regularly, since the risk of injecting into one of those small blood vessels is very, very rare, especially as you press the plunger, the tip of the needle slightly moves, and it is very hard to really stay inside of one blood vessel and inject it right into there. All right, I hope this video was helpful. And last thing, if there's some blood appearing at the injection site, just apply slight pressure with some gauze or some some alcohol pad, and it should stop bleeding after a couple of minutes, and it's usually not a big deal. I hope this video was helpful, and please let me know what you think in the comments down below. Thank you.